examination, you see that nothing on the coronaries, no epicardial lesions, maybe a hiatal hernia, which might explain chest pain. You see the arrow here. Esophagitis, who guess, who knows? But something here is shown, and I asked you, we did an MR the day after, for a reason, of course. What do you see on the lower row? T2 steer, T2 mapping, and late enhancement. Again, the question is edema, yes or no? Late enhancement, yes or no? Ischemic or non-ischemic?
Yes.
Yes. Does it look ischemic?
No,
No. Who wants to comment? No, and the other thing is there late enhancement?
No.
No. Who wants to comment on the distribution of edema here? What is very particular in this patient?
With an aspect.
On the aspect of
The?
on the aspect of
Yes, the apical distribution. You see, edema here and here, nothing here. This is T2 mapping, and you can see from the color, pink is normal. Let's say yellow or orange is abnormal. This is a disease sparing the base. What do you think is this condition? Takotsubo. Takotsubo syndrome. What is Takotsubo? It is also called broken heart syndrome or apical ballooning, telling you two things. First, very often it is associated with an emotional stress. If you ask the patient, in 80-85% of the cases, they had a previous episode of intense emotion. Secondly, apical ballooning is related to the fact that there is a remodeling and expansion of the apical segments with hypercontractility of the basal segments. And Takotsubo is something else I will tell you in a second. Interestingly, why does this pattern exist? And the reason is very likely related to the fact that catecholamine receptors that are interacting with this in this condition are overexpressed in the heart in mid and apical segments. So since there is an hypercatecholamine production related to the stress, this causes a remodeling of the ventricle that spares the base. Another feature that is very important in these patients is if you repeat MR after 1 month, it is totally normal. So this is the family of non-obstructive coronary artery disease. Do you remember this morning we saw Minoka cases? The alternative is this. The strength of MRI is that this is the only tool to make a diagnosis in vivo, histologically or related to histology. And of course, in these patients, we have all clinical criteria. Another example, 38-year-old female, she recently lost her father. This is even more striking. You see, totally remodeled, dilated. There is edema in the middle image, sparing the basal segments, no late enhancement. And here we had a biopsy, which shows us a lot. What happens in Takotsubo? Catecholamine stretches the fibers. This is exactly like a muscular injury you can have in the thigh or in the arms, etc., etc. And the reason is the stretching of the fibers produces massive edema, but no myocardial damage. It's exactly when you have an injury wherever. It repairs very well, and doesn't associate with a significant necrosis. That's why we see it like this. So what is this? It is a Japanese vein